Please, let's take a seat. And we're going to go back with the third block of today's event. I also wanted to say hi to everyone on the streaming channel, and the YouTube or LinkedIn channel. We're going to start with the next panel now. We're now going to start. I'm going to ask you for some silence because people following us on the streaming service, if there's no silence, it's a little bit of a chaos. So, well, let's start with the third block for this forum. So it's all more or less linked. After Gorka's presentation, we've seen a visualization of several concepts with Miguel's presentation. And the last block, what we wanted to do with it was to give visibility to specific experiences on the application of social innovation from a systemic view. I think the four speakers that are going to be doing the presentation, I'm sure you'll have a lot of information, a lot of inputs that have inspired you, and even at your heads, you have thought that you wanted to say something specific. So, as I said at the beginning, for the questions, please let's show the slide QR again. So we're going to have the four presentations, and at the end, we're going to move on to the Q&A. As you know, we have the Slido, and for the streaming services, I'm also going to remind you that you can write your questions through the chat of both channels. Let me also remind you the survey about the carbon footprint. And with no further ado, we're going to start with the presentations. This third block, we've called it Social Innovation in the Path Towards Systemic Change. So in the final part of this event, we want to keep on learning and getting to know practical examples of social innovations that have made tangible progress. The selected experiences have influenced or reshaped public policies on different levels, but not just on a political level, also for the multi-stakeholder collaborations. We wanted to identify experiences from different levels on a more state level, regional, local, and even international. And there's two people coming from a public administration and two from a civil society. The truth is that all these cases are really inspiring, and behind what you're going to see now, there was a conviction, a clear purpose, and a lot of work to try to do things differently than what's usually done. So I'm going to give the floor to the next speaker, Sara Buesa. She's the Director of Inclusion from the Basque government, so you have the floor. It's a pleasure to be here today and share with all of you this event that I think is really inspiring. And I think there's a lot of threads and inputs and common links that make us connect and think that we're all going towards the same path and walking all together. And at the same time, it's a little bit overwhelming because they give us this idea of each one's participation and how we can improve in our own processes. So I'm coming from the Basque government, from the Department of Economy, Labor and Employment. Inside this area, we have a line of work, which is employment in inclusion. And we have been developing this strategy from this field and from the Basque public employment system. So I'm going to explain a little bit what these mixed itineraries for social work or social labor inclusion. It's basically processes for structural exclusion, and they are addressed towards the people that have a position of inequality because they're facing barriers or limitations in different um, life fields, both professional and personal, and they create especially vulnerable situations. So it's more of a structural debate what we tackle, and it's from tackling that complexity and how to tackle complexity situations from a different outlook. So these itineraries are also thought to think cross-sectional intervention. So each professional is not just going to work on their competence field, on their specific field where they work, but their regard is enriching and feeding and needs from the professionals from the other systems and vice versa. At the same time, this intersectional practice is applied to all the aspects of the intervention from diagnostics, planning, resource allocation, etc. Professionals need to see how situations are creating an interrelationship in all these vital fields, and from there to see how they can give in the different portfolios for different services in an encompassed way. It's also part of a dynamic and contextualized idea of exclusion. This is not just a matter of the individual field of people, but people live in contexts and environments that are dynamic and never changing. What can be a barrier or an obstacle somewhere doesn't have to be in another one. And we can see in a dynamic way and the possibilities and the situations that people live. And for us, the key aspect of this is the teams for the assessment and the intervention teams that we're working with. We believe that we're tackling a change of paradigm. This sounds like really important, right? But it's basically understanding employability in a different way. Well, a paradigm is like a way to formulate a problem and to tackle solutions to that problem, and it persists over time. And we have tried to review the way that we formulate problems linked to employability and in the way that we formulate solutions. In this new paradigm of employability, we have been taking a twist to understand that the employability possibilities of a person do not have to do with strictly professional or working contexts that we're very used to work with in the employment system to analyze everything that has to do with qualification, professional experience, language, knowledge, digital competences, have clear goals, etc. All these elements that are commonly worked with in the employment systems, that there's socio-personal factors that also have an influence in the possibilities of different people. If a person doesn't have possibilities of having revenue or housing, if they have difficulties participating in an itinerary, counting with social support network or community networks, or even transport, for example, in some areas that can create conditions for that, the legal, administrative situation that each person has, the capacity of working autonomously in their daily activities, healthcare, how our health, both physical and mental health, they're really important elements when it comes to knowing how a person can be closer or further away from accessing employment and how that has an impact in all those itineraries. This is a little bit the opening of a wider regard that we have tried to do. We have also talked about the importance of acting at different levels and also having a regulation framework. As an administration, having a legal framework is important when it comes to supporting the processes that we do. And this change in paradigm, we don't do it because we just wanted to do it, but because we really have a framework that is supporting us, and they have even asked us to work in this regard by understanding inclusion from the Basque system, from that broad and cross-sectional regard. When I talk about employment protection, social services, whenever it's precise with education, healthcare, and housing services. And the law in itself also shows that we need to have diagnostic tools for social and work diagnostic tools with this regard, and developing integrated programs and inclusion staff that can actually help us. In formulating this problem, we developed a scale, the brief scale of employment and inclusion. We have created it and validated it with the University of Eusko. And we have this multidimensional approach that includes both professional elements and socio-personal elements, a sociological approach, understanding that employability does not really depend on individual aspects, but it depends on elements from the environment, from the context, the interactions that happen between people and their contexts from a very functional approach. We describe the situations of people. We don't like to do judgments of different people, but to analyze each particular situation and from the optics of up to what extent the distance towards employment is higher or lower, or there could be barriers or limitations or any obstacle that's stopping our path. And the goal of this scale somehow is to do an initial assessment that allows us to do in some kind of screening in what way there could be barriers or limits or strengths in different fields that we are talking about, to identify at least first the kind of support that a person might need. This is the picture of the idea this scale has. The result, more or less, is that in all those social, personal, or professional fields, the result is a little bit to see up to what extent there could be a significant barrier or a limitation that we need to tackle, some element to do a follow up, or strength that we need to strengthen. And the application of that scale has been incorporated in the intervention model for the public employment system. In all cases, and all the people that have this service, they incorporate this in our initiatives so that you can have a global vision. So far, we have done a couple of years with this new model. We have applied, I don't know if this is really much updated, we're close to 40,000 downloads of these characteristics. And basically, the results that we have from support profiles is divided in three thirds. People that will need once in a lifetime support to actually be able to access employment, people that maybe will need a more intensive support by the public employment system, so an itinerary that's personalized, and maybe comprehensive programs that coordinate training systems and more intensive support systems that we can develop. And then a different profile for support where it is probable that that intervention needs to be integrated with other fields or systems. That's where mixed itineraries are found. So, how to tackle this kind of situations that are complex, that are generated, that intersectionality that we have talked about, where we see that crossroads of needs from different vital aspects that create an intersectoriality situation. We understand that intersectionality is the response that the welfare state needs to give to intersectionality. For that, we like to use the metaphor of this game. I don't know if you know that child game. So that's called Mikado. And it's a game in which you throw all those colored sticks, and they're all more or less mixed. And you need to take away the different sticks. Each one will choose a color without dismounting the whole structure and without it moving anywhere. For us, those little sticks, those colors, would mean the different obstacles or barriers in different aspects: social, support, economy, healthcare, employment, education, housing, revenue. So the art of this kind of processes has to be that between all the professionals, we need to see what's the barrier or the obstacle that needs to be moved at each time in an encompassed way so the whole structure does not dismount. So if we intervene from our field with the best of our intentions, of course, and with the best professional action, but working on our little sticks, we'll probably just take the whole structure down and we don't do it well. So the process we developed, we started it in 2022. It's a long distance itinerary, and I think it's important because if we're thinking about intervening between different systems in the in the welfare field, because if we have a portfolio for different possibilities and services and planning a calendar that's different in if we tackle situations that are interrelated with that complexity that we were talking about, it is clear that so that this prospers, we need to build this together from the base. And that requires some time and some work and some dialogue to basically set up the foundations for this. Another important idea of this project is that we try to follow quite an open or experimental or bottom-up methodology, although we're now coordinating the level at several levels on the macro and on the smaller level. So we did a first stage of conceptualization and design, a general framework of what we understand are the mixed itineraries and conceptual framework. And from there, we launched an experimentation level. We knocked on the door from the third sector, housing, education, our own fields, and talking about everything that we wanted to do. And well, it's thinking that we can create proposals from this framework. So it's a very open and flexible framework from which we can extract learning experiences. And we know that our goal is to create a model that can be scaled. And all this process is basically learning new experiences and creating new products. Over these 18 months of learning, we extracted learning that helped us define a model for mixed itineraries that could be validated. And now we're at a new stage that I'll talk about later, where besides reviewing that model that we have painted in the theoretical part, we also want to have a second product with that it's an intervention model with good practices and everything. This was the first stage that I've already explained. The experimentation stage that we developed is quite open and very flexible. We were interested as well in having a diversity of projects, the highest diversity. We developed 14 projects in which we had the involvement of more than 60 professionals, mostly in 3 fields: employment, social services, and healthcare. We developed 3 projects with healthcare, one with mental health in Alaba and employment, and another itinerary linked with situations of exclusion, addictions, and working with different entities. It's public systems and different collaborating entities from this sector that have been quite involved, and they have also helped in many other things. 361 people participated, and I don't really like to talk about profiles, but if we talk about profile in that more classical language, let's say, we have quite a big broad participation: women, single mothers, people with a irregular documentation situation, people with mental health problems, etc. We've had quite a big diversity. And for us, it was really important to do encounters with all the professionals to share and extract all over the process, to extract those learning experiences on how all the stages of the intervention can do for the joint work and collaboration. From that moment, we created that model of mixed itinerary. We did an evaluation as well, and I'll show you the results later.
What does this document as a model? We have the different systems that are activated and engaged, how the teams are distributed, the team, the processes, all of the phases, steps to follow, and also a coordination structure to have the inclusion policies structures. We want to systematize this and including it in the system. Well, I'm not gonna delve into detail in this part here because of time reasons, but I want to highlight, nevertheless, the key are the teams. We are not just talking about accompanying. We have those teams of consulting and intervention that work in a shared way. Those teams are composed by references of the public systems, because for us, we need to start from public responsibility and then we boost a little bit quality-wise in engaging the public systems. So we should have 2 reference from representatives from the public institutions. Also, we have experts coming from the third sectors, specialized in different subjects. But I think it's important to highlight this because with this process, we have to be clear that we want to make something different. We want to go beyond collaboration that we also have a more integrated approach, and having a different model from the one when I'm referent, when I've been transferred from other institution, and we wanna make this quality-wise boost. And how, as I was saying before, intersectional approach is key when tackling these issues. This collaborative approach, having common goals. We had situations, for example, in the mental health project where the orientators were incorporated in all of the meetings, in all of the monthly meetings, and this approach of common interviews to see how to tackle the different obstacles. This gives plasticity to the different systems, and beyond our limitations and beyond our resources that can be activated, we can have this common vision of more flexibility. And we've been creating also a belonging sense that has been really good. And I'm going to show you a super short video of the teamwork of Pilar Navarro, which is a consultant of the Employment Public Service. She's been working with monoparental families, single parent families, and with the altogether with a third party and the town hall of, and with what your experience, what can you extract from the intangible? Where can you say something's going on, even if in quantitative terms we cannot put a match? We have two assessment levels. Women wanted to participate with us in the project. Also, we have the team assessment or teamwork and the project itself. So, regarding the women that have participated in the project, something that is really clear is that they perceive that their quality of life has improved in general, and they recommend to the people they know to participate in our project as well. And also, they ask us if someone they knew could participate as well. So this was really positive to hear. This is a project, a long-term project, because it's an ambitious one, and this is what makes us have big successes. In, as Thomas said, sometimes they don't have base concept and they come to Astaro, but we know where this person is, and if we don't know, after being with this person, we transfer it to the more competent person. I'm gonna skip this part of the presentation, but just so you have this idea of the teamwork, and this is the new step we're working on right now. We have this document model. We modelize, we document learnings, and we've drawn a music artwork, let's say, but we have to give it back to the orchestra to see if everything makes sense, or we should rethink. Because when you systematize a model, you give it a little bit of stiffness, but we should see if this works or not. In September of this year, we started a pilot model through 9 different projects that in that moment in the moment the model is being adapted, and we are assessing whether the coordination we've made works or not. And this is the phase we are working on right now, with more than 40 professionals engaged from the different employment systems, healthcare systems. And it's true that the model also considers the inclusion of housing or other departments that are not for the moment included. So apart from making a revision of this theoretical model, making the necessary adjustments because it's a living model, we should adapt it to an intervention models. And what is this for us? There is a lot of enriching experiences that we are not documented enough. So what we want is to give the tools so we can make it, or the professionals can make it. we've given back this document to the database in order to make surveillance, but also we adapted this model to the macro governance structures that there are for inclusions. For example, we've created a working team on mixed itineraries where all of the systems are represented, also the social sector, employability, healthcare, housing, education, social services, all of the responsible people from the government, from different departments, and we've been trying to discuss the model that we've theorized to put it in practice, and this is a piece that will be a pillar for future actions. And there is going to be a progressive deployment of this project at a multi-level. So I want to give you a couple results of this project. The assessment of the 18th months of application, and we had this before and after of this project. You can see the evolution. We have in red the barriers, more than 50%, limitations. There's been a reduction, and there is a clear proof of the advantages. 73% of people have experimented this improvement, significant improvement against the barriers that they have originally. This is the average of obstacles that these people have before and after participating in the project, and even we have a surprising outcome at the binary logic of simple employment or not. We want to have this process towards employment approach, but even with this logic, we have surprising outcomes because they are itineraries that are long and complex. And at the end, we have 2,025 people employed, and there was a group that had just a residence permit that could legalize their situation with along the process. I'm getting closer to the conclusion, but I want to tell you about the mental health initiative in Alave with people that have chronic mental conditions, and also highlight the collaboration with the third sector. We're going to see a video. For us, it was a success, and I'm going to explain myself. There's people that have been that stayed in the step of elaboration of the CV and just that, but never like they knew during this step. For example, a person that wasn't valued, that didn't value themselves with their experience, they were able to see their expertise in paper, and the next step from that is to get to training. So for each person, for each patient, it was just a phase of of the process, but they start scaling up. And as this is a program that has no end, that has no begin or ending, the objective of the program is to create a dynamic to learn, so the users can progress with their relapses or not. So that's why we have also the third sector engaged for giving them support. So for me as well, it is important to have this mixed itinerary program. I am in the socio-sanitary coordination, and I'm hoping someone to explain to me what is this socio-sanitary thing. But I see, and I've seen from my experience, that this mixed itinerary program established a change of paradigm, which is real for the social sanitary coordination. So, lastly, some reflections of some conclusions of this process. We need to have time. We started in 2022. I don't know where we're going to end, but the important is to gather all of the pieces. Also, we need to invest time from the professionals. It's not just important to create these systems, but we need to change the systems. We talked about cultural changes, model changes, intervention planning changes, also internal system changes. Also, we have to have multi-level commitment. It's key that those professionals have a following up structure at the middle level, and to also document this lesson learned so we can scale up. Also, regarding the intervention, this consumes the most of the time, and we are really we really use to dedicate a lot of time on this part. And it's important to give space for reflection. Maybe we don't have much people in this step, but we should make model of those lessons learned. Also, talking about the laboratory phase, we had a super open and flexible step. Now we have more rigid phase. The richness of the first phase has been fabulous, because in order to build, also you have to be open at the end, and then getting closer and getting closer and closer. And that's all I had to say. Thank you. Thank you very much, Sara. Making these kind of changes within the administration is not an easy thing to do. We knew this experience within the framework of the Social Inclusion Network, also funded by the European Social Fund, and they foster precisely this of better integration of the social services. And we are aware about that because we are a part of the network. We are aware of the difficulties they have in order to access different administrations. There are not that many examples at the regional level that we can extract, such as the one that we had just now. So they are really focused on this long-term approach, plasticity. So work on the plasticity of the systems, and being comfortable in that is also key, and it depends on the people that are working on the projects and the initiative. So it's also a way of visibilize the processes within the administration, also linked with this objective of the social network in the different systems. Also, thanks to the participation we have in the BIRDS program that they told before, linked to the competencies and cases. We knew some experience. We knew the platform Vidas, which is a social innovation project. And I think it's Patricia that explained it before. And it's really oriented to transform different policies of healthcare. To talk us about this, we have Judy Sala Morales, partner consultant and social researcher in Tangente, which is charged on the technical secretariat of the Vidas platform. So Judith, when you want, you have the floor to explain to us what is this platform and what changes it has created so far. So first of all, thank you very much. I want to tell you multiple things. The idea is that Berta was here, which is the Secretary of Social Right, but she asked to Tangente, which is the consultant company of this ecosystem of innovation, to do it in her place. I want to tell you that there's many initiatives, and I want to also to explain my role here today. And I want to tell you that we've been engaged in this process. Other question that I want to mention is that I'm lucky. So Patricia and other participants have talked about many things that I'm going to talk now. So this is going to be helpful for me. So this is the main thing we show when we want to talk about the Vidas platform. And the objective of all of this ecosystem that is implemented and funded from the Social Rights Ministry. With that, we want to tackle a really complex challenge of transforming the long-term healthcare system. So it's important, and I'm going to focus in this specific case because in practice applies to everything that's been said before. Also, I'm going to talk about how does it include all of the dimensions we talked about: complexity, multiplicity of agents, of multiple sub challenges, and the presentation. It's from Berta. Well, it's inspired from Berta. It has its hairstyle. Some images have been already shown, but it's okay. I think it's a good sign. And it makes sense because Gorka has been also with this project, so a lot of the technical framework that accompanies this public policy is going to be based on the approach that's been explained before. It's This part is a little bit redundant, so I'm gonna skip it. But I was interested on how to have this logic within the public administration, in this case from the social rights ministry. How can we tackle these changes without transforming this care model and these politics that were rigid and centralized, not just through different initiatives at a local level, but without articulating. So, what is the approach from the secretary to build a framework of principles, values, strategies, listening spaces, co-creation spaces? And I'm gonna use a lot of the concepts that have been used. It's useful because I don't need to explain them again. But accompany this co-creation and active listening process with learning, systematization, and proposals that can ultimately change the process, the system, sorry. So it's not just the Vidas platform, which is a piece of a more ambitious project. It's about connecting this high skill program and contributing with these small solutions and funding them from this strategy. Is a little bit of what's being explained. What we need to do is to shorten these two transformation levels. How do we try to do this from the Secretariat of Social Rights? Through the Vidas platform, and I'm going to delve into detail about that because it's the platform that we have supported from Tangente, and through two basic pillars that have been also present within the collaboration process, and they've been creating an information flow between the actors. First of all, from research that we've made from the University Carlos III here in Spain, and we've introduced all of the things linked to care in 4 specific population sectors. I'm gonna focus on in the most interesting, but we've tackled old people, disabled people, homeless people, also child and youngness, and including them, or all of the people including within the social protection system. And we wanted to create this ecosystem to integrate different entities of the third sectors, also experts, also participants with expertise. And this is a complex network, but really good, that's been giving good results. Also, we've been extracting lessons learned in order to create novelty changes through the different strategies for the institutionalization for a new model of care within the community. So this is a result that goes on the same line of the program, in parallel with the program. I'm not gonna delve into the complexity of the challenges. We agree that transforming a care model is a social challenge that is complex as well. But what should be interesting is that in order to transform this challenge, we start from a paradigm, from an approach, an umbrella approach, common umbrella that is linked to values, human rights, intersectionality, empower life, uh, people at the core of the measures, data, uh, and other concepts linked to social innovation and also co-production. What I mean by that, the idea is that all of this innovation process of proposing, experimenting, they have a common goal based in certain values. We mean we want to change the care existing system because there's things that we don't agree with and we want changes. Having as a base those values. Public administration have thought about how to boost this cultural transformation because in the end to change the care system should be linked also to a cultural change of what is care, how should we care about those people. That's why we created the social innovation space that includes a lot of the dimensions that have been mentioned before by Gorka. And some of you are part of the Vidas platform. You've seen it thousands of times, but it's interesting to present this experience to people that maybe don't know about this or have not been so committed with that because the data are really important and this is a challenge where the social rights ministry was involved and this is only linked to the Vidas platform. So beyond research, that was really important. Also, all of the development and writing of the strategies. There were other different lines. We're here just talking about the Vidas platform, which is a company space, systematization space, opportunity creation space, also co-creation space, through the creation of pilot programs or social innovation projects with a value of 356 million of investments through the next generation funds, and that includes 137 organizations coming from the third sector. So there are more organizations that project because it was sometimes a result. Projects were sometimes a result of the union of many organizations. So in these 20 projects, we have different projects for old people, for disabled people, for children. So these are the different projects. Some of them have been shown already. And the Vidas platform is it's an acronym from learning about innovation, and we talk about deinstitutionalization. And the first idea was to first tackle and agree on the fact that we were towards the same challenge, and afterwards to distribute it along the different sub challenges. In this case, in order to change the care system, with people at the core of the initiatives and the community at the core of the initiatives, and creating more specific challenges, for example, linked to different specific collective. For example, how to reinforce the families or how to promote the transit processes to communities. So we had a mapping of certain challenges, some of them specific and some of them transversal, that were the most valuable throughout the process. One thing that we learned from the assistants and from the secretariat is that we started with the logic of the entity we were working with, and we ended up working in a transversal way because we realized that the challenges were the same sometimes. Last names, service, the public service we were working with. For example, the names or the kind of public service could change, but the challenges were still the same. And this is linked to the visions that Gorka was mentioning. Every single approach can have common elements. what did we really mean when we were talking about this innovation system? It has multiple dimensions, but the objective was to reach this, to have the same logic within all of the pilot programs that we had, and let's say get out of the logic of projects. I think it's difficult to get out of that, also from the sector, because they have sometimes uh, demands from finances, but getting out of this logic and get in an innovation portfolio, so creating a list of lessons learned, and beyond the project, this is not naturally done. We need some tools, spaces, and construction sessions, the systematization of all of the projects. Each one of the projects had their own research line. So one of the work that's been done from the Vidas platform was precisely to organize, create new lessons, and create learning communities. I think we're gonna give some examples afterwards that tackle some of the sub challenges that I've mentioned before, more specific challenges in these learning communities, communities of learning. We had people coming from the different sectors of the populations, and they came out of their logic. And in a work of 2-3 years, we create general documents and tools useful for the different projects, so they could understand that what they were creating was beyond their model. It was more about creating an ecosystem of knowledge, learning, and evidences that could be useful ultimately to change public policies. And this is a little bit what I was explaining, some of the elements that I think can be linked to what was said before. We had the connections, convergences, and all of the connections that were issued from the project. That's why it was important to create online and on-site meetings, so we could progress in this innovation and testing step, for comparing it also well with other projects, to see that there were common and uncommon elements. And this created also lessons learned, also join all of these common points of each one of the projects. Also the territorial implementations. And from that, we started highlighting tendencies that were beyond the project. This is one of the things I'm going to skip. So this allows us to organize and systematize all of these learnings in what we call the innovative solutions portfolio. So we've changed the name a little bit, but that's what it is. What we wanted is to organize with all of the information and all of what was going on, and we established a series of missions. The main one was to change the care system. We established a series of challenge, and through experimentation that's been done through the different projects, we went to systematizations. We created more than 100 innovations that we documented, and we aren't finished with the documentation, but we established a series of categories. For example, innovation linked to transition processes, accompanying processes, or innovation linked to the organizational system. And we made 100 findings and recommendations based on the recommendations we had. We didn't say innovation in this case because we didn't have enough knowledge behind, but this is knowledge important to make recommendations or suggestions. But beyond the Vidas platform, I focus on the innovation portfolio, but there are other tools that were also useful for the process, linked to the database. which is this systematization of learnings. This is a public thing you can access if you want. Also, the scaling guide. I'm not gonna get into detail, but this is an accompanying tool to have this scaling up logic within their projects, because it makes no sense to have social innovation if you don't have as an objective to scale up. As an example, these are the different categories. All of the innovations linked to the to institutional transit, and in this category we can find different innovations linked to the different projects that have common aspects. So in this systematization work, we see that these innovations have some things in common if we see the examples. For example, protagonism of a certain person's, a comprehensive preparation, community networks, support networks. I had 4 or 5 categories, some of them linked to roles and skills. Some of the learning elements in those innovation processes created this new accompanying model, new roles and specific skills. We found this need, and they proposed then those new roles. Some of them can be similar. For example, we have the emancipation reference. And for example, they saw some similarity, and there were some transversal elements. The housing subject, that was a transversal subject as well, that made us realize that there's no isolate problem. For example, we should meet with housing or the healthcare systems. And in order to conclude, there's a short element. And one of the things that I consider that is interesting, and I didn't systematize because there's a lot of work yet to do, but we were talking about competitiveness and the importance of this at a European level and how this should be linked with social cohesion. One of the interesting elements in all of this innovation process is to systematize through the Vidas platform the analysis of the cost versus the benefits. In these models, we have privileged an assistentialist model, but we had nevertheless important data, for example, within the different projects linked to homeless people that told that the unitary cost per person, for example, is 57 euros versus, for example, including all of the services and all of that, include all of the portfolio, and comparing it to the conventional costs for a place in a conventional residence. For example, there was another project linked to UNICEF, which was more of a prevention of institutionalization project, and there were studies highlighting that this previous investment in the improvement of quality of life and skills in order for these kids to stay in their families, it was contributing to a reduction of the costs, comparing it to the cost of having those kids in a center. It is not the factor that levers all of these processes, but it's useful to speak the same language as the public institutions so they can scale up those proposals. We wanted to include most things of this kind because we were discussing all those processes, but with the accompanying research and with all of this systematization, we have evidence that a lot of the solutions were more efficient, economically wise, than the traditional ones. And this is more or less our experience. Thank you. Thank you very much. You did. It was really interesting. And also, it was interesting that you highlight that you mentioned academia through this study, so through this research study, and you highlight the importance of information along the process. And you also highlighted those analyses of cost versus benefits. I think step by step, they're gonna go hand in hand with these processes. And also, we, as a technical sector, we should develop the necessary skills to do those kind of analysis, and in order to mm, take better strategic decisions. Let's get to the next presentation. We met her at the Social and Innovation Forum. I met her last year in Brussels, and we exchanged like 4 words. We went to have dinner together afterwards. So everything was so fast. So our next guest comes from France, and she comes here to explain an intervention model that is that I think it was interesting to bring here. Also, it's a part of what Sarah said of this change of paradigm, and in a practical way, we see that all the people in the community have can make their own contribution. So starting from there, she's gonna explain the kind of intervention model she's developing, and she's gonna also explain this model that is transforming the lives of many people in the community. So I'm gonna introduce sorry, Victoria Basurto, Head of Research and Evaluation Monitoring. And the project she's gonna present is Territoire Zéro Chômeur de Longue Durée. So it's territories with zero long-term unemployees.
Well, that's when unprecedented situations happen, we need to adapt, right? Well, so I'm going to talk about the project Zero Unemployed People that have a long-lasting unemployment situation or long-term unemployment situation. This idea is that it's a project that's based on a principle, which is employment as a right. You'll tell me it's not. Work, that is a right, employment, not that much. The starting point is the French Constitution. Each one has the duty of working and the right to obtain employment. We realized that both in France, but it's also a European reality and a world reality, there's a duty to work, but that right to obtain employment is not necessarily effective for everyone. So, how can we do it to propose something that might come without replacing what exists, to complete the existing offers inside the state? In this case, the French state. For this, we need to base on three principles, which are the main ones on our project. One of them is that no one is unemployable unless the employment is adapted to the person. The opposite way, yes. It's not jobs what we need, because there's not a great number of needs that are not satisfied when it comes to a territorial level. And it is there where we position in many of the cases, and I guess you will also know it, the social and solidarity economy. We have a lot of opportunities that are not foreseen in the classic economy, so we need to create them. Third one is that what we need is not money. You'll say, well, But no, it's not money what we need, because at the end, not having an employment, we don't talk about long-term unemployment because we believe that unemployment is not an individual option, it's something that has been taken away from you. So that aspect of taken away from society and the state a lot more expensive than what we were saying a moment ago, then investing or reinvesting that money that they give to people to stay in unemployment in the employment creation, what we call the activation of passive expenses. For that, we have several elements that we need to take into account inside its execution. One of them is that it is a project that has been developed with and from the people that have not being offered unemployment. They know what their needs are, how they can contribute, and how they can contribute themselves and the community to solve this. Secondly, is what we call the exhaustivity project. What does that mean? That from the moment in which a territory decides to implement this project, what is the goal? The goal is to have zero long-term unemployed people, not to end with unemployment, that's differently, but to generate the options that come to give a response to each one of the people in that territory that have identified as volunteer to be part of that project. The participation of the people in the project and territories is volunteer. That's also important to remember, because the implication really changes that people will have in the project, and the political willingness will change as well, because it's not someone who needs to assume the collective actions, but they can be thought about differently. From the moment where we can say, okay, so why not trying this in this territory? This is two stages in order to accompany the project in a centralist state, which is this state of France. There's a law, which is a territorial experimentation law, that allows territories and mayors to be able to experiment an aspect of their municipality, in this case it's employment, for 2 periods of 5 years. Over those 2 periods of 5 years, either the project is institutionalized or that is left in the state that it is, or they can reject it. They have both options. In this case, there was a project, a moment of implementation from 2016 till 2021, in which we experimented with the project in 10 territories, 5 urban projects and 5 rural projects. And from that first experimentation, who says law, we need to vote it in the parliament, the National Assembly, the Senate, etc. And the project, which is quite particular in any way in the French political environment, both times that we had to circulate through the Assembly and the Senate, it was voted in unanimity all over the political spectrum. So that support, that political willingness, that makes in the end everyone to say, well, employment is not something that depends on parties, so what should we do? So from that second law, we could move on to the next stage, which was moving on from 10 territories to nowadays having 83. When I say nowadays, we moved on to the second stage of the project that was started in 2020 or 2021, and it ends in June 2026. So what's going to happen? The parliament will decide it, and the negotiations, the ongoing negotiations, will also say it. What are we basing ourselves on? In the strength of having said that over almost 10 years, the project showed that we could get people out of the situation of unemployment. And one of the results is that it was 7,100 people that left this situation of unemployment, that they created 83 territories, and inside those territories, 91 companies looking for employment, because in the end the goal is to create a balance of those structures. the end goal is not to create profitability, it's to create employment, and through employment, to create territorial cooperation dynamics. Another important example is saying, well, but you create companies only to employ these people, and then what's the link with the rest of the local economy? Okay, we're going to see that later. But I wanted to tell you that precisely 31% of the people that were volunteering the project is people that found employment in classic economy or inside the structures for the social and solidarity structure in the territory where they lived. It's a social innovation that turned out to be innovative and inspiring. Right now, we have 14 territories in Belgium that are trying to implement this model with differences, because this is not just about doing a copy paste of what was done in France. It's more about starting from what are the territorial needs, what are people's needs, and what can we do to try to match one thing and the other. The second country that they're experimenting on is Italy. There are two neighborhoods in Rome where that was launched, and they created an association with the same name as the French association. Since we don't have a lot of time, I'm going to quickly show you this information. But I wanted to tell you that this is a project where most people that are now employed are women, which is not a surprise if in the end we realize that what the project promotes and what we propose from those companies is employment adapted to the person. What does that mean? That means that we need to adapt it to their family reality. Women nowadays, they can't work if no one can take care of their children, mostly if they're the head of the family. We have seen that there's many women who are the head of the family that have integrated the project because they can work some hours or the hours they decide. They don't necessarily need to start with a 35-hour employment contract, which is the legal time in France. So full-time does not block me. People do not get in the project for their CV or professional experience. They go in because they want to. What do you want to do? What don't you want to do? What are you willing to learn? How can we, from your participation, do this? Because people participate from the beginning in the setup of the project, in their elaboration, in its dissemination, and also as a relay to the other unemployed, long-term unemployed people to inform them about the existence of this project and what we intend to do. What we want is for that right to be efficient and possible and accessible for everyone. So then we need to mobilize so that everyone knows that that possibility of accessing exists on a territorial level. So we're going to identify the people on the base of being volunteers, of course. We have identified what their skills are, what their capabilities are, and what we're going to do. That made me think about what Gorka was saying of those diagrams that are not as beautiful, but that's what works in the reality of the project. How does the project work? The main leg is this. That's what we call the local committee for employment. Inside that local committee for employment, who's there? All of those who want to make an employment a right in their territory. So that means that you can find public administration through the public service of employment. You can also find social services. We also have the third sector, that's what you call it, social and solidarity economy. And inside that, we can also find inclusion companies because they are also present in the territories. The companies that are addressing people with disabilities, etc. So the whole sector, of course, also including the sector of what we call classic economy. Why? Because at the end, as I said at the beginning, it's not a project that wants to replace what already exists, but it wants to reinforce what already exists, to make it more dynamic and to see how we can do it, because maybe the companies that are created inside the project are not useful for everyone. Maybe the people just need a final push to jump on unemployment in a classic economy and not necessarily an adapted accompaniment. So, how can we do it all over that process to reach everyone to find the answer that adapts to their needs? So, this local committee has the hard task of ensuring territorial consensus. So, it's going to be in relation to all the actors of the territory, both economic, social, etc., with the people that don't have unemployment. And also, what we needed, and we talked about it now, is political willingness. Without political willingness, we don't have anything. I have 4 minutes left. If you want more information about methodology, we can talk about it, no problem. So there's a political accompaniment because it's the mayor or the mayoress on that territory who also leads that space for local committee. Departments are part of the local committee, regions, etc. So it's a multi-level matter. What I said before was the link with the public employment service. There's a link that is not only done through partnerships, but it's a multi-level partnership. We saw that with the example of the Basque Country. If the project, in spite of the fact that it's a civil society project, bottom up, it's pushed by local communities, if it needs, in order to exist and to advance, move forward, etc., to transform, if it needs that second level, second or third level, in France it would be the department, the region, and then the state, if we need a multi-level dialogue. So there's a national partnership with the Public Employment Service. Why? Because they already said it twice. We don't speak the same language. And it's normal. We don't have the same administrative tradition. We don't have the same way of working. So then we need to know how I can address the France Travail, which is the public employment system, and how can I talk to the CEO of the biggest public entity. It's not the same language. So how can I do it to adapt all of that? So on a national level, we created a kit for tools between the project and the public employment system to say, hey, let's do a awareness raising campaign. Let's talk to the people who carry the projects from zero territory and the agents from the public service. On a territorial level, we need for them to participate in the governance. It's them who are also facilitating the access to people on the information on the project. They are participating with the project teams in accompanying people to identify the different skills, to identify what are the companies that could be interested in the territory. They're a key actor. And it also has a lot of branches. We have the employment section on a rural level, then we also have the community centers for social action, for local action, municipal social action centers. All these actors are part of the local community for employment. Another element that I wanted to highlight was that even if we said that we needed to create an adapted employment, we didn't expect almost 32 people that have been employed in a project to be people with disabilities. And there we don't know how to do it. The question was, is it our role in this country to work on that field or not? And just like we created partnerships with the public section for employment, but if the FACIP, which is the fund that does this, does it really well and they're going to do it, how can we translate that to a territorial accompaniment? So that has created references for disability in each one of the companies inside the project. That has also allowed us on a national level to understand what are the limits and what we need to better accompany territories in that sense. This is to say that the project, since it doesn't compete with the public service, what we have realized is that it strengthens it on a territorial level, and it also adds a complementary layer that's sometimes missing. is that layer of proximity, of going door to door, on who are the people who need this, how can we better accompany them, and sometimes the public employment system can't reach. To talk about the matter of institutionalization, because finally, how has this transformed the project, the matter of employment? I just wanted to say that we are in a process of wait to know how we institutionalize the project, and inside the evaluations that have been done by the government through the Court of Accounts or the Ministry of Labor, we have identified spaces where the project could be inserted inside the global structure of the French employment system. And let me wrap up by saying that since everything is multi-level, we're in Europe and we can't forget the European level when talking about employment matters, among others. There have been several initiatives in which the project has had an influence. One of them was quite valuable for us. Valuable because it is the space of the European Committee of Regions. It is the space of territories. And it was in the European Regions Committee where in 2023 they passed the report that invited the European institutions to fund projects that fought against the long-term unemployment and projects such as the French project that I have just presented. So that I don't talk too much, I'm also going to leave these elements, and I wanted to say that nowadays the project has also been acknowledged as a tool to fight against poverty, and the results from those analyses have been done by the UN and by the International Organization of Labor. So we keep on working without that having that final goal, which is that systemic change, but we're still on the doubting phase where we need to keep on negotiating to see where the project will transform the system in 10 years. Thank you. Thank you, Victoria, for sharing your experience, and we wish you the best of luck when the project is back to the parliament. And well, let's wish the project is institutionalized. So to wrap up, we're going to give the floor to Bartomeu Ayala. Hi, Bartomeu. Good afternoon, good morning.
Buenos días, ¿me
Good
¿sí me
morning.
escucháis bien?
Can you hear me well?
Perfecto.
Yes. So Bartomeu, thank you for being here with us. He's the head of health and social innovation in Altaya, the University Healthcare Network of Manresa. The project that he's going to share is basically shared or common agendas. You'll see that he'll visualize, we'll see in the line of this concept of agenda has been quite repeated over today. Bartomeu, thank you, and please go
A
ahead.
vosotros primero, gracias
Thank
por
you.
invitarme.
Thank you for
Lo que quiero
inviting
hacer
me.
ahora, básicamente,
I'm going to
es
talk about common
introduciros
agendas.
un nuevo concepto
In fact, it's a new concept,
y se trata de cómo
and it's
diferentes
about how different actors in the territory,
ámbitos social del tercer
including social sector and third sector, work together to face common challenges
las agendas
through obviously
Si vais al siguiente, me pongo.
shared or common agendas.
Bueno, aquí veis esta diapositiva lo que señala es
In
que
this slide, what you can
vivimos en un
see
mundo que
is
cambia
that we live
exponencialmente.
in
Tenemos
in a world that
tecnología,
changes really
pues
fast. We have
tecnología,
technology, culture,
ciencia.
economy,
Estos
science,
cambios
and
generan
these
tensiones
changes are
en nuestro
creating
sistema.
tensions in our current
Los
system.
servicios, las
On the
administraciones,
services,
las sociedades,
administrations,
todos
and
estos
social
trabajan
measures,
diferente.
they all work differently.
Al final, los retos globales nos afectan
Basically,
globalmente
global
y
challenges affect us
necesitamos
locally,
alternativas
And we need shared spaces to understand them together and to be able to
el tema
act.
de la agenda compartida.
That's why we talk about a common agenda.
Básicamente, aquí vemos que no es un modelo lineal.
Here we see that it's not a linear model that we are used to so
En este
far.
primer bucle que habla de un sistema
In this
equilibrado,
first loop, it
que
talks
causa
about
un declive, se necesita
decadent
una
system. There's
transición que acompañar este
a
decaimiento con
fallout.
una
We
nueva
need a
estructura
transition
y un sistema
and to
nuevo que
accompany this
supone un
process
futuro, ¿vale?
in a structure that creates a second loop,
La
which is what we
transición que
see
se
next to
produce
it.
no
The
es directa,
transition that happens is not
se
direct,
superpone.
it's
Por tanto, esta
overlapping.
diapositiva
Therefore,
dice
this slide,
demográfica,
which is showing a
es un
demographic
sistema que el
result,
modelo actual
there's a
empieza a
system which is the
quedarse
current
obsoleto.
model that starts being
Surgen
obsolete.
iniciativas
There are
nuevas,
new
pequeñas y
initiatives,
prometedoras.
smaller and
Las agendas
innovative,
compartidas ayudan a
and
que estas
common agendas
iniciativas
help these
crezcan y
initiatives
salgan
to
a la luz.
grow and to come out to light.
Muchas iniciativas comunitarias o
Many
del tercer
community
sector
initiatives or
son
from the third
semillas
sector
de sistemas nuevos.
are seeds
Las
from
agendas
new
compartidas
systems.
ayudan a
Common
bautizarlas,
agendas helped
fomentarlas,
name
darles
them, connect
visibilidad y
them, give
hacerles
them
visibles.
visibility, and make them grow.
Todo esto veremos ejemplos.
For all of this, we'll see
La gráfica
examples.
muestra pues
The
un sistema
graph
actual
shows
que era
a current
estable,
system that was
las tensiones
stable,
globales que lo
global
condicionan y
tensions that are
controlan
putting
esto,
pressure on
y
this,
surgen ventanas
and
de
we
oportunidad
have
para
new
cambiar y mejorar.
opportunity windows
Es en
to
los momentos
change
de
and
tensión
improve. It is
que
in the
aparecen
tension
estas
moments where we
oportunidades.
can see these
Para innovar
opportunities.
en la
To
parte social
innovate in the
necesitamos
social part,
identificar
we
estos
need to
modelos.
identify these
Ahí
tension
es donde las
models.
agendas
That's where
compartidas
common
tienen un papel
agendas
clave.
have a key role.
Si pasas la siguiente, por favor.
Next slide, please.
Aquí vemos ya
Here we
el
can see
ecosistema.
the
Aquí vemos ya
ecosystem.
la Generalitat de Cataluña
We
dentro
see
de esta
that the
principalidad
Generalitat de
multimediana.
Catalunya, or the regional government of
Aquí vemos
Catalonia,
cuando
is inside the
distintos
RISCAT
actores,
2030, and we see
desde
several
entidades
actors,
sociales,
administrations,
empresas,
social entities,
ciudadanía,
companies,
gobierno central, lo que
citizens,
sería la quádruple helix,
the
trabajamos
Helix
por el territorio.
quadruple
Y esto es lo que depara
axis.
todo el tema de la agenda compartida.
This is everything related to the common agenda.
Por tanto, las agendas compartidas no solo son
Therefore,
teoría, como
they are
veréis
not
más
just
adelante,
theory, as you will
sino que
see from
ayudan a
now
hacer
on,
que
but
las
they
nuevas
help
soluciones sociales
make
se
new
adopten
social
y se
solutions to
mantengan en
be
el tiempo,
adopted
como
and to
está
be kept
pasando
over
aquí
time,
en
as it
nuestro
is
país.
happening right now in cases of our own.
Si pasas la siguiente,
Next slide.
tenemos que aquí pues, la Generalitat de
What
Cataluña
we have
por
here
temas
is that the
presupuestarios y
Generalitat de
agenda
Catalunya, through programs
sitúa
and
esta agenda
RISCAT
compartida como el
2030,
instrumento prioritario de
places the
innovación
agenda
como
as a
países en
priority
progreso.
element for
Quiere
that
un modelo
innovation.
verde,
We want a
digital,
green model that's
transparente y justo.
digital, resilient,
Pone
and
énfasis en
fair.
la vulnerabilidad y
And
desigualdad.
that's how
También,
it
por cierto,
wants
esto
to
es
tend to
ahora
the most
no se veía
vulnerable
en Madrid.
situations, and it wants to
Esto es
reduce
clave
inequalities that
para temas del
somehow
sector
was
social
not taken into account. That's
en los que
key
hemos estado
for the
trabajando.
social sector that we have been
Por
working
tanto, las
on.
agendas compartidas
Therefore, common
es un
agendas
respaldo
give
político
that
que se
political
necesita a la
support
administración
that we
y
need from the
financiación a
administration
soluciones
and funding
que
towards
mejoren la vida de las
solutions that
personas
are
más
going to
vulnerables.
improve the lives of the most vulnerable people.
Si pasa a la siguiente, aquí ya entramos en materia.
Here
Vemos
we
cómo,
delve into
cómo hemos
it.
pasado del reto
We
a la
see how
oportunidad.
we have moved on
Bueno,
from
pues aquí
challenge to opportunity. What we can see here is something that's really important,
que
to
es la
have that
gráfica que hemos
quadruple helix, the
visto
A,
y que
B, C,
trabajamos
K that we have.
conjuntamente,
Public administrations,
empresas,
we work
trabajamos
locally, companies
conjuntamente,
or
la
businesses, we work
ciudadanía
together,
está totalmente
citizens,
representada,
they are completely
el tercer
represented,
sector está
and the
totalmente
third sector
representado,
is
las entidades
totally
sociales
represented,
están
social
totalmente
entities are
representadas
totally represented,
y después el conocimiento,
and then
universidades
knowledge,
y centros tecnológicos.
university and technological
Por tanto, el
centers.
tercer sector es
Therefore, the third
súper
sector
esencial.
is
Está en
essential.
el centro del contacto con
It's
la
in the
comunidad
center
y
of
aporta
contact
la
with the community,
responsabilidad
and it gives
que las
a
otras
social
élites no
regard
poseen
that other
y es la
elixes
oportunidad
don't
para
have.
aprender,
And it's
superar
essential
la
to
lucha contra
understand
esos problemas
and to give solutions to
más importantes, como en este
the
caso en
most
Manresa,
important problems, like in this case in Manresa, it was the topic of
por tanto, de
aging.
aquí pasamos del reto a la
So
oportunidad
from here, we move on
tenemos
from challenge
que
to
hacemos un
opportunity.
diagnóstico
We have that
compartido,
we have created a
importante.
shared diagnostics.
Identificamos
That's
las
important.
fuerzas
We
que ayudan a que esto
identify
empiece
the
frenas y
strengths that are
importante,
helping in
generamos una
slowing
visión de
down. That's
futuro
also
sobre
important. We
la realidad.
generate a vision for a shared future.
También
We create it.
trabajamos la teoría del
And we
cambio.
also cause
Es
the
experimentamos
theory of
diferentes
change.
soluciones
We
para esto.
experiment with different
No todo
solutions to
siempre
see
es
which
bueno.
one is the best. There's not
Y hay
always just
un
one.
foco en el impacto
And there's a
colectivo.
focus on
Por tanto, los
collective
problemas
impact.
sociales
Therefore,
se
social
convierten en
problems
oportunidades de
become
innovación
opportunities
donde se
for
trabaja
innovation
colaborativamente.
when working together.
Pasas a la siguiente. Aquí, por lo tanto, en este esquema,
Therefore,
pretendo
in this
que lo
scheme,
leáis
which
y
I don't
veáis
want you to read
qué es lo que
everything,
estamos
but
haciendo
here
aquí.
we have the
Nos
identification of the
pedimos quién
challenge.
son los actores del
We analyze the
territorio,
actors of the
determinamos el
territory.
protagonista del reto,
We determine what are the
empezamos a pensar los cambios que
protagonists. We need
queremos.
to think of the changes
Hay
that
una
we
creación
want.
del grupo
Then there's a
autónomo,
creation
este
of
núcleo
the
duro que
engine
impulsará el
group.
proceso. Las
It's
identidades
the
sociales y
nucleus that's
políticas
going to foster the
necesariamente
project.
representadas
The
bien y
identities and the
sobre todo
people implicated
importantes.
have to be
Se genera una hoja de
well
ruta de
identified and well
ciudadanos.
represented in the project. We
Por tanto, la
create
misma
a
propone
roadmap for citizen
co-creación,
actions. So we propose
co-creatividad,
real
experimento
co-creation
piloto,
experiences,
porque como
creative
veréis, los
methodologies,
laboratorios
pilot
tienen cierta importancia en
um,
esto.
projects,
Pensando en las
and the labs
soluciones
have some
no
importance
diseñan
here.
en
Therefore,
un
the
despacho
solutions are not
donde estoy
designed
yo,
from an
sino
office
que
in which I
co-crean
am, but
en
they are
comunidad.
built with the community.
La visión de futuro es importante. Es importante porque es una visión de futuro
Future
compartida.
vision is important because
Aquí
it's a
aparece la
shared
visualización
future.
de la agenda
Here,
compartida de
that's
aquí
what
de
we have.
cohesión.
Let's say this
Este
is our
futuro
guiding
también
star.
deseado
It's the
que todas las
desired
entidades
future that all entities in the
puedan
territories are going to agree
interactuar,
on
alineen
and
sus
towards which
esfuerzos.
we are aligning our
Esto garantiza
efforts.
que todas las
This
decisiones se
guarantees
tomen
that all decisions are made
pensando en las personas,
thinking about
no en las
people, not
instituciones. Y
about
aquí ya ponemos a la
institutions.
persona en el centro de todo.
And here we put the person at the
Hacemos
center
mapas
of
que
everything. We
hicimos un
create
trabajo que nos
maps.
costó muchísimo,
We did a
pero estos
map that
mapas
took a lot of
sirven
effort from
para
us, but they work
entender
so
los
that we can
beneficios de
understand the
usar
complexity of the
esta herramienta
challenge.
entre
You'll
nosotros,
see the one that we have
identificar las
created,
palancas de
identify
cambio
the key
y
levers,
generar un mensaje
and
claro.
in the end, a clear
Ayuda a ver
message.
que los problemas sociales no son
Help
lineales,
because
tienen muchas capas
social
y que
problems are not
requieren abordajes
linear, they have a
amplios
lot of
y
layers, and
profundos.
they need
Por lo tanto, esta
broad and
transformación que
coordinated
hemos visto
approaches.
antes de
So
la
the
fase
transformation that we
inicial
have seen from
nos lleva a las
ABCK
políticas
lead
públicas
us
más
to the
adaptadas,
most adaptive public
nuevos
policies,
modelos de negocio
new
comunitarios
business
que dan
models with a
importancia
social
a
impact, which is
estadísticas
important because here
epidemiológicas,
we have talked about
cambios de hábitos,
several
empoderamiento
changes in
social,
habits and
investigación
empowerment and
con impacto real
responsibility,
en la comunidad y
investigation
por la
or
otra final,
research with an
este
impact in the
sector
community,
tiene una
and
capacidad de
basically the
influencia
third sector
para
will earn more
incrementar
capacity
y
of influence, legitimacy,
centralizar
and
estos
resources
cambios
to
estructurales.
push for these structural
Pasando al
changes.
siguiente, para entender todo esto,
To
que no es
understand all
fácil,
this, which is not easy,
aquí hay una anécdota que nos
here we
pasó
have
en
an
el Museo del
anecdote
Barrio que está
that
dentro de la
happens
ciudad, que
to
es
us
Plaza San Domènec, que ahí la
in the
imagen
city, in
del
the Plaza
fondo,
San Domenic.
y el reto es el Banco de la Paz.
And the
Es decir,
challenge
cuando
is
estábamos
the
trabajando en estas
bench
bases del
in
territorio,
that square. When
entrevistamos
we
a
were doing a
profesionales
territory
de
analysis,
distintos
we
profesionales de distintos
interviewed
servicios,
social entities,
todo el mundo
neighbors,
hablaba
professionals from different
de la
services.
dependencia,
Everyone talked about
la falta
dependency,
de coordinación.
loneliness,
Pero
the
un
lack
día,
of coordination.
aquí en un
But one
encuentro
day,
entre
here in an
abuelos
encounter with
del barrio,
elderly
en
people from
por
a
ejemplo,
specific
en
neighborhood,
este caso, una señora nos dijo,
one woman
hey,
told us,
dejaos de tonterías,
"Hey,
el
stop
problema
with
es
the
el banco.
nonsense. The problem is the
Y
bench."
todo el mundo, no, ¿qué banco?
And we said, "What
No,
bench?"
preguntamos. Y ella respondió, el
And
banco de
she
la
said,
plaza.
"The bench
Lo
in the
quitaron porque
square."
decía que
They took it
molestaba.
away because they
Y
said
desde
that it
entonces
was
no
bothering
salimos,
them. And since
salimos
then,
poco.
we don't go out,
Aquel
or we
banco
go
era
out
donde
less.
nos encontrábamos,
That bench, that's where we
conocíamos
used to
la
meet,
comunidad.
where we
Sin ese
created
banco
a community.
no nos
Without that
conocemos.
bench, we see each other less.
Sabemos menos los unos de
We
los otros
know
y
less
nos
from
sentimos
each
más
other
solos.
and we feel more
A
lonely.
partir de ahí, identificamos
From
el
there,
reto,
we identified the
¿no?
challenge.
Al final, los
In
espacios
the end,
son importantes,
spaces are
donde estaba
important,
este banco.
like where
Son
this bench
espacios del
was.
barrio facilitan o
These
dificultan
spaces
la
in the
vida
neighborhoods
cotidiana
are
de los
making it
vecinos.
easier for
Se creó un
daily
cuerpo
life or
motor.
making it harder.
Este cuerpo
We
motor
created an engine group,
hizo que incluyéramos a estas
and
personas,
this
a
driver
la
group
ciudadanía, la
made us
gente
include
mayor,
these
para
people, the
realmente generar
citizens,
soluciones.
older people that
Y
had
al
the
final
problem.
generalizamos ciudadanía y
In the
co-creación.
end, that's the
Cuando
citizen
hicimos los
participation and co-creation. When
participativos,
we did the
al final lo que
participative
quedaba y lo que nos acordábamos era el
mm,
reto del banco.
workshops,
Porque era parte,
we all remembered
¿vale?
the bench.
Al final todo estaba
And in
conectado.
the end, everything was
Digo que al final,
connected here.
¿qué?
And I
Todo
say
lo
in
que
the
es
end
la
because
propuesta, la
all
solución,
the
al final
proposal
este
and the
problema
solution of this
era que
problem
el
of the
banco
bench in the end
conforme al
was to
banco
get that bench back.
la
And
gente
when the
este
bench was
problema
back,
se resolvió,
people
¿vale?
thought that
La
this problem was
administración.
solved. The administration understood it.
Sí, para pasar a la siguiente. Al final aquí tenemos
Here we
publicaciones de
have
todo,
several
porque al final la evidencia
publications for
científica
everything because in the end,
es
scientific evidence and being able to prove is necessary to explain that what we're talking about works. We have several publications that we have done.
pasa a la siguiente.
Among them, we have this one.
Tenemos la teoría del cambio.
We have the theory of change from healthcare
Ejemplo
to
aplicado dependiente, por ejemplo,
well-being.
nosotros en
That
Madrid,
was an
en esta zona
example
somos mucho
of
dependientes
people with
por
dependency and chronic situations. In Manresa, we live
y
3% more. We're older than the average in Catalonia. Must be because we're under a
las
mountain and
personas
that
aquí en
protects us.
Principio de Cambio
But people here
han
in our theory of
participado
change
antes,
have
y lo tenéis
participated
en
in the
contra.
solutions.
Hace
Citizens are
tiempo cuando
empowered.
nosotros
Institutions share
construimos,
information, which is
había una
important.
metodología para crear nuevos
There's a
servicios,
methodology to create new
hemos buscado
services.
el
We have
centro
placed the
y
person in the center,
esto hace que promueva
and
esta
this makes
corresponsabilidad entre profesionales desde la paciente hasta
promoting
el
this
paciente.
co-responsibility
Hace
among
tiempo
professionals
durante
more
ciento y
important.
pico
We have had the
entidades
participation of more than 100 of entities and companies
apenas
in the whole
un 10%
shared
de la población
agenda. That was a
tiene
challenge that we
acceso
had
a la
never
administración, no solo a la
achieved
local,
so far.
sino
And
también
inside this,
desde
we had administrations,
nuestro
both locally and from
Si
our
pasas a la
government.
siguiente,
If you move on to the
podemos ver el
next
resultado de
slide,
este
we can
trabajo
see
que
that the
duró
result from this work
8 meses,
that lasted about 8
aquí
months,
hablando y tal,
here
es este
talking and
mapa.
everything, we
Evidentemente no
saw
podemos
and we
explicar el
created
proceso.
this map.
Este mapa nos sirvió para
This map helped
conectar,
us
es decir,
to
para poder
connect,
explicar
to
cuáles
be
son
able
los
to
obstáculos
explain what are the factors that mainly make it
nos ha servido para
harder
identificar
for
cuáles
us.
son
It
los
has
retos
helped us to
y nos
identify
ha
what the
servido también para
challenges are
implementar.
and also to
Somos seres
implement
innovadores. Pensar
innovative
que en
solutions.
organización
Think
nosotros, al menos aquí,
that
no
in
innovamos en plan de software.
here
Entonces lo que
in
estamos
social
implementando.
aspects,
Por lo
we
tanto,
did
todo
not
este mapa nos
used to
ayudó a
innovate.
identificar
Now we
qué
do innovate
barreras,
in this. So we
barreras
needed to create this map to
organizativas,
see what
barreras
barriers,
culturales, como decíais,
organizational
y por lo
barriers,
tanto,
community, social barriers,
simplemente
etc.,
dejar de
existed.
decirles tenéis que trabajar conjuntamente.
So I'll say it, stop the
Si
nonsense, you
pasas a
have
la
to work
siguiente,
together.
verás esto
If you move on to the next one, we see that
vemos
in the
el nivel
end,
de complejidad que
we
hemos
see the
llegado,
level of complexity that
porque
we have
tenemos
gotten to,
en una banda
where
individuo, comunidad,
in
entorno,
one
y
layer we have
luego
individual,
persona,
community, and
organización,
turn,
sistema. Hemos
environment,
tenido en cuenta
and in the other
la
one we
salud
have
física,
person, organization,
los
system. We've
recursos,
taken into account
las horas de
physical
disponibilidad.
health, work
Es una
health,
mirada
resources,
no 360, pero
mental
sí una
health.
mirada
It's
muy
not a
completa.
360
Si
view, but
vemos
it's a much more
todo
holistic
esto, lo
review.
que pasa a la siguiente, por
Move
favor.
on to the next one, please.
Al final esto lo que
In
nos
the
va a
end,
permitir, esto
what
que nos
this
está
will
explicando,
do will
tanto
be
Miguel
that
y Martín, parece
if he's
un poquito
explaining this, I
definitivo
had,
de esto
well,
que
we
estamos
had this
haciendo,
this
donde estamos en
explanation,
pleno
and it
trabajo
was quite nonsense, right? But in the end, we were
solucionarlo.
able to solve it.
Ejemplos prácticos que hemos tenido a consecuencia
Practical
de esto.
examples that we've had in the
Pasando
consequence
al
as a
siguiente,
consequence of this work with a
hemos hecho
shared
y
or
hemos
common
trabajado
agenda.
atención
We
integrada.
created an
Esta es
integrated
una
health
parte
and social
pequeña que
service
hemos hecho
model.
para la parte
And
todos
the
los días
biggest
hacemos una
integration was that
reunión
we
de
could do all of this
administración
together.
pública, hicimos
Going
un
back to
proyecto
public administration, we created a model that was called CIS Manresa, so integrated health and social service model, and this is
y con
forever
esto quiero
now.
deciros que la
And I just wanted to tell you that the
personas ha hecho que estén mejor,
domicile
ha aumentado su
assistance
calidad,
of people in their house has improved their quality of life, and from healthcare, we have reduced 80% of urgent services. This innovation model has led us to work a lot, but we have had technological improvement and innovation. We've created a software that both in healthcare needs and social care needs, we have worked in innovation. The social worker, which used to be unknown, now we know what's her ensemble planning. We have done this together both with doctors and nurses and social workers and occupational therapists and family worker. We know what we're doing, we have a plan, and we tend to the people looking at this plan. Next one. This led us to do a very important change, which was that we have created a model in which we have moved on to have from patients to people, and that led us that we applied to the European Awards on the Expert Patient, and we received this award precisely because we have changed this concept, because we have changed the people that are at home and receiving home care. Now there are people, they're not patients, and we treat them with care. So that you can see in the next slide, this is the whole technology that we have done. We have created this software, but we have connected AI with falling prevention, also environmental control, remote medicine. We also have assisted showers. We have beds that make posture changes. We also have several at-home care beds. we can monitor people in a much easier way with just a picture with their blood pressure meter, or just with the AI. It it lets the nurse know if they are not okay. It tells the social worker if they haven't eaten that day. We have done this all together, and this has appeared in the way of working together. We currently, in this project, we have 12 technological companies that have come up from the need, from the social need. Therefore, we have created a portal for the caregiver where they have all the information from a formal caregiver, from the work of the family, to have a series of resources for that person. Now I'm going to show you a video that is quite significant for us. And well, it's translated into French and Catalan. We couldn't do it in Spanish, but it's quite significant in the sense of how the team works in the domicile and how we're tending to the people with this model and with this solution. We're currently tending to more than 200 people with this system. Please, can you play the video?
We're gonna stop here because we are short on time. So if you can go to next slide, this is all of the team of in comprehensive assistance composed of nurses, occupational therapists, and social worker amongst other people in other projects, so you can see the outcomes of having common agendas. It's this project of 3D food training to people that have problems eating food. You can see the companies that have worked on these projects. Another project is these modular homes, totally adapted, where we make use of technology in order to improve quality of life of people. Yesterday, precisely, we received an European award as an innovative project for new housing types for improving the quality of life of people. It was with big satisfaction that we received this prize. Let's go to the next slides. We can see all of the institutions and companies that have been engaged in this project. We have companies that clean forests, and with the residues they build homes. And afterwards, also we have the social part where we facilitate housing to people that have problems accessing to decent housing and that get into the program, and we connected them with people in the same situation within the same organization. In the end, all of these infrastructures, it's been created from all of this. We have labs, um, meetings such as this one. We have a simulation system with the university as a main actor, and we learn from this technology. We have entrepreneurship programs for lateral thinking. We have 3D projects. We adapt houses. We do in-house assistance. So we give community solutions, as you can see, and we put them in place. Here you can see the modular houses project a little bit more. And in the end, creativity, in conjoined creativity, it's only the result of the connection of all of the actors. If we work in common, we have houses like this that we implemented in 4 regions, focusing on rural areas. Lastly, I would like to focus or expose some phrases that are really the result of the teamwork and that are really significant one. One of them is when the territory gathers, listens, and dares to try new things, the magic is not a miracle, it's the result of collaboration. Also, we mix ideas, we create challenges coming from the people, and when we connect people, resources, and idea, the territory stops reacting and starts transforming. This is really key. Other phrase that I like is if we work together, we make challenges become opportunity, and we have a rural area that takes care of people. So we take care of people and of the territory like this. Thank you. Thank you very much, Bartomeu, for the presentation. Really, with those last phrases that you've shared, we can see this is a synthesis of many concepts that have been mentioned today. I'm gonna ask, please, to get to the Q&A session. Bartomeu, I will ask you to stay a little bit connected because we're gonna get the Q&A session with you. And also, I wanna ask Sarah, Judith, and Victoria to get on stage for the Q&A session as well. And we're gonna have, as I said, the Q&A session with Bartomeu and all of the participants. Okay, I would like to ask a question to each one of you. I'm gonna ask you to be as brief as possible. For Sara Buesa, they are asking, technologically wise, how did you manage the data exchange within the different parties, and also how do you manage the governance of information? We have the healthcare system, social services, and the third sector that are involved. So how did you manage the exchange of information? This was one of the weaknesses and one of the biggest challenges that we have had. We know that this should arrive, this need of creating shared tools, it's there. All the time, we are asked to economize tools and have these data spaces to exchange information, but we didn't want it to get really limited at the beginning or create a big complexity for the different agents that were going to intervene. But it's something, nevertheless, that we're tackling right now. We have precisely a research study linked to all of the technological tools with the idea of identifying those elements that should be shared within the integrated learning pathways, and in order to identify what should be exchanged in order to have a better articulation. And this is one of the biggest technological challenge that we haven't tackled as much yet. For you that you did, Vida's platform has more than 30 social innovation projects. Is there a connection between those projects, or have you foreseen to have a connection between them in the future? One of the positive results issued from the process is that in other calls, there were alliance projects coming from different entities that are part from the platform, even coming from different collectives. For example, one of the alliances, I think it was Barci and Plena Inclusión. And we have similar cases. We've worked beyond the platform, and we have all the shared spaces. I don't know. These are the positive impacts we've seen already. For Victoria, within your project of territories with zero long-term unemployment, what were the difficulties of the implementation of all of the initiatives in Italy and other countries that have participated? If the person that asked the question wanna discuss afterwards, you can. But one of the main difficulties, I wouldn't say difficulty as such, but one of the questions that emerge when replicating these kind of strategies is the juridical side. What is the support at what kinds of laws can I use in order to better support my project, and how to economically can I manage to face the employment creation with the companies, and how can I manage the territorial dynamic, etc., etc. We found two interesting things in order to solve the questions. First of all, creating strong alliances with researching, implicating different universities that work the possibility or not of doing the project at the university. And second of all, we have the role of Europe and the European social funds in the replicability of these kinds of projects. So some of them have a part that's been funded locally and an EU funded side. So the opportunity is mainly to, for example, projects that want to do the same thing that we're working. And the idea was to gather this person locally and see if they met the needs they wanted to solve or not. Thank you very much, Victoria. Leslie Bartomeu. Talking about common agendas, we talk about the need that exists of better comprehension, communication between the different actors. I would like you to share a key examples or initiative from that can be put in place tomorrow in order to better the communication and improve the situation in general.
Sobre todo, es decir, si se identifican los problemas,
If we identify the problems, they should be tackled
no sirve, digo, aunque yo
in a
llevo trabajando en banca y esto le
they should be
sirve decir
tackled
esto
conjointly.
es
It's
social,
not just
sino se tiene
enough with saying this is a health issue or law issue. We should
dentro del centro.
put things in common and having people at the core of our initiative. If we identify already the needs, in the end, we should work adapted to the territory we're working with, and this is a way to increase effectiveness. We've learned also making mistakes, so this is the advice that I would give to gather all of the organizations that should give an answer to a certain problem. It's not going to be easy at the beginning because each actor has its own interests. It's about gather all of these people that have this open mind to have a discussion and then finding solutions together. Thank you. Well, thank you very much. Thank you very much, Bartomeu. Thank you. And I'm looking forward to meet you in another occasion. Thank you very much for sharing your experiences. So we've reached the end of this session. I hope that you that it met your expectations. We've all talked about all this collaborative approach that we've seen through examples that have been put in practice. Also, we've seen another aspect that I think it was interesting. All of these portfolio managements, since public policies to different levels or layers, I think we had clues as to where administrations at the local or regional are going, and step by step, maybe we are creating a cycle of changing our way to manage the social aspect with this concept of portfolios that has been mentioned again and again today. So this is something that we should learn from and privilege information that we can extract from this session. Because if we keep on with this approach, this is going to change the way we work right now and maybe what we are essentially. So that being said, thank you very much for being with us today, in person and online. Thank you to the translation team, to the technical team. It's the first time that we have a translation booth, actually, and I think it's been a success, I would think, and we will foresee to include that in future events. Thank you very much for the streaming. Thank you very much. Thank you, everyone, for being here today. And I hope that in the 14th edition to see you again. And I want to say a couple comments. If you haven't filled yet the form regarding the footprint, you need to fill out the form. You're going to receive also a survey in order to assess the performance of during this session. Also for you to give you key ideas or suggestions for the organization of future forums, so we can better organize this kind of meetings. So thank you very much. Thank you very much to the people that came from outside of Spain. Thank you for being so generous to share your time today, and thank you for sharing your time and experience. See you in the next forum, and for those participating in the forum, so for the speakers, I will ask you to come to the stage to take a family photo, and the catering, so just so you know, it's ready yet in order to have this aperitif. Thank you.